It's great news for Teesside to enable us to put into place very quickly the recovery element of COVID response. It's great news for our patients, great news for our staff across Teesside. So we can implement some of those changes to facilities and optimise our estate to enable patients not only to come into the organisation and be segregated around our infection control measures, but also to think about how we can respond quicker to patients' needs and improve the waiting times. So this is enabling us to prepare for winter and the increase in activity we expect during winter, but it's also enabling us to prepare for what could be that second wave and the unknown. And therefore we need to be very prepared to enable our staff who have worked tirelessly during phase 1 of COVID to actually think about how they can manage patients through waiting areas and improve their waiting time response to patients. Again, it's great news for Teesside to enable us to put into place very quickly the recovery element of COVID response and to enable us during the winter period to enact that 111 response time and 111 reaction. It enables us to actually put into place that talk before you walk, and enables us to make sure that the public feel very comfortable with coming up to accident and emergency and presenting when they have an emergency situation. And if they don't have an emergency situation and need urgent care advice or guidance, to be able to ring 111 and to look at the pathway that they may need to undertake. But it's great news in that we can enact some of the work that we wanted to enact last year across Teesside, especially around same-day emergency care, and specifically across paediatrics, and enable us to increase our response rate and improve our response to children, and enable us to optimise our resources in accident and emergency. We would always say, if you have an emergency, ring 999 if it warrants 999 or 111. And for the public, don't be afraid to come into accident emergency. We have done everything we can around our facilities and our staff to ensure that we have a clean environment, we have our infection prevention control in place, and we have masks that staff and patients will wear during every interaction, and we also have hand hygiene facilities available. So for the public, please don't be afraid to come into our organisation. We've done everything we can to minimise your reaction to risk, but we also want to manage your emergency. We do not want you to sit at home. Thank you to all of the members of the public who've supported the NHS during this very, very difficult time. Thank you to our staff who've worked tirelessly, as I've said, to work through this COVID period. And again, once again, I would just reiterate, if there are issues that you feel as though there's an emergency, please don't hesitate to call 111 or come into accident emergency.